Good evening, ladies and gentlemen. It is exactly 9:31 New York City time, Eastern Standard Time. I am broadcasting live on my podcast from the New York City metropolitan area. So tonight we are going to discuss the pandemic, COVID-19 pandemic. What does it mean, and what does it mean to people, and how is it going to affect our daily lives? I never thought that in my career, I would see a pandemic in my lifetime. When SARS broke out in 2002-2003, although there was a hysteria, it did not reach the global reaction like the COVID-19, like what the COVID-19 is doing now. When the World Health Organization announces a disease outbreak as a pandemic, it's not a word that is used lightly or carelessly. It is a word that if it's misused, it can create unreasonable fear or unjustified acceptance that basically the fight of the disease of the outbreak is over and that public health has given up. And also, this can lead to unnecessary suffering and death. 3 weeks ago, the World Health Organization and other public health officials around the world, they were very short in discussing this current outbreak to be an epidemic. Now it has reached 114 countries. And it's not slowing down. And the cases of COVID-19 outside China has increased dramatically. And the number of affected countries around the world has tripled. It is not something to be taken lightly. Although this is not 100% kill, that if you get infected, you are likely to die. It is not that kind of disease, but it is frightening because of it's frightening and it's getting this much attention because of the rapidity of transmission and how it's transmitted, and there's so little known about the virus yet. Coronavirus has been in existence as long as human beings are alive, have been alive. And this pandemic that is sparked by coronavirus has never been seen before. This is the first ever pandemic caused by a coronavirus. This pandemic has never been seen, and it cannot be controlled at the same time. That is according to the statements of the World Health Organization today. And for those of you listening from across the world, that was yesterday in your time. It is very trying times because we don't really know how many cases there are undetected or untested in the United States. As of the information that I have gathered yesterday, there have already been about 1,700 people who were tested in the USA. Whereas in Korea, in South Korea, there were 188,000, take note. It seems like the United States is lagging behind in trying to contain the spread of the virus. I have also noticed the lack of concern from some people. It's very difficult for me to talk about a pandemic because I never thought that in this day and age, disease outbreak like this that is hard to contain is happening in the year 2020, in the age of modern technology, in the age of computer revolution, in the age where we are surrounded by modern technology. Just a few days ago, looking at the numbers of cases around the world, I just never thought that it would come to this. That pardon me, guys, because I'm still having difficulty with my voice. That's why I'm basically just like struggling. But I just needed to do this tonight. It is something I have taken an oath to help the population, to inform the public as much with factual information based on scientific research and from reliable sources. So I still believe that what I have posted today, that containment is very difficult, and also there are some countries that are struggling because of lack of capacity. They also lack of resources, and they also lack of resolve. They don't know how to tackle the burden, the public health burden. What I can just say, that if the numbers of cases in the United States continue to rise, it will overwhelm our public health system and also our healthcare system. It's it would be extraordinarily dangerous for the elderly and for the very, very young to be exposed to this type of ailment, to the virus. Because around 50% of the deaths, of the cases of deaths, are with the elderly. And if you are young and healthy, you are more likely to recover. Unscathed. However, those people that you are going to infect, like the elderly, very concerning indeed if the virus infect nursing homes. That will be a catastrophic result. Although we ask the public to not panic, there's no reason indeed to panic, because you will recover. Over 50,000 cases have recovered from the cases in Wuhan, in Hubei province, in China. And it's likely to happen also around the world. But those people who have compromised immune system, as well as, and also the elderly and babies, they will likely not survive this outbreak. That is why it is very alarming, and it's very important that the public be very, very vigilant. Because if not, according to Dr. Gabriel Leong, he was the scientist who fought SARS in 2002 and 2003. If this is not contained, it will likely infect 50% of the world's population, and about 65 million of us around the world will likely to die from the virus. So it is necessary to communicate with the public about the risk and how they can protect themselves. This is not just public health issue, not the government's issue, but this is everybody's business. Everybody must get involved. Everybody must be vigilant. We must help each other, because this outbreak cannot be fought alone without the help of the public. What is necessary for countries is to find, isolate, test, and treat every case and trace every contact. Have all hospitals ready. Protect and train healthcare workers. We need to look out for each other, because we need each other. We should not be fighting for minor things.